The World Health Organization, WHO, has once again declared Mpox a global public health emergency, marking the second time in 2 years. This situation is dire and the implications are far reaching. Stay with us as we unpack why this decision was made, what it means for global health, and how you can protect yourself. This declaration follows a troubling outbreak in the Democratic Republic of Congo, D.R.C., that has rapidly spread to neighboring countries. On Wednesday, an emergency committee convened to advise WHO Director General Tedros Adhanom Ghebreyesus on whether this situation should be classified as a public health emergency of international concern, P.H.E.I.C. Tedros underscored the gravity of the situation, emphasizing that the detection of a new strain of Mpox in eastern D.R.C. and its alarming spread to other countries signals the need for an urgent and unified international response. This outbreak is linked to a new version of clade-1 of the Mpox virus, which is known to be more transmissible and capable of causing more severe illness compared to clade-2, the strain responsible for the 2022 outbreak that led to around 100,000 cases worldwide. The current situation is especially concerning because clade-1, which was originally confined to Africa, has now spread internationally. The outbreak began in January 2023 in the D.R.C. and has since reached 12 other countries in the region. Just recently, on Thursday, Sweden confirmed the first known infection of clade-1 outside of Africa, although the individual was infected while in Africa. Similarly, Pakistan confirmed a case on Friday, though the strain has yet to be identified. Dr. Anne Remoyne, an epidemiology professor at the University of California, Los Angeles Fielding School of Public Health, highlighted the urgency of the situation by stating, "We should have learned a lesson from 2022 that an infection anywhere is potentially an infection everywhere." A public health emergency of international concern, P.H.E., is the WHO's highest level of alert. It's declared for serious, sudden, or unexpected health events that pose a risk across borders and require global coordination. The aim of declaring a P.H.E.I.C. is to boost research, funding, and international response efforts. Past P.H.E.I.Cs include the Ebola outbreak and the COVID-19 pandemic. In response to the escalating Mpox outbreak, the Africa CDC has declared a public health emergency for the continent. Dr. Jean Kaseya, Director General of Africa CDC, announced a plan to deploy 23 million vaccine doses in 2024, starting with 10 million doses next year. He assured that efforts are underway to ensure vaccines are distributed effectively across African nations. Additionally, the WHO is stepping up its support by releasing $1 million from its contingency fund for emergencies and is seeking an additional $15 million to enhance surveillance and response activities. 2 Mpox vaccines have been approved by national regulatory authorities and recommended by WHO's Strategic Advisory Group of Experts on Immunization, SAGE. These vaccines will be distributed through Gavi and UNICEF, with the emergency use listing process underway. How does Mpox spread? Mpox spreads when a person comes in contact with an animal or a person who has the virus. Transmission occurs through direct contact with an infected person's bodily fluids, sores, scabs, or respiratory droplets. This can also occur through cuddling, kissing, or sex. Contact with recently contaminated materials exposed to skin lesions, including clothing or bedding. Scratches or bites from an infected animal, preparing or eating meat or other products from an infected animal, or direct contact with an infected animal's blood, bodily fluid, or sores. Mpox symptoms. After exposure to the Mpox virus, the average incubation period is 1 to 2 weeks before symptoms appear. Early signs of Mpox include the following flu-like symptoms: chills, exhaustion, fever, headache, muscle aches and backache, swollen lymph nodes. These flu-like symptoms are then typically followed by the development of a rash. The rash can look like pimples or blisters and can be painful. Lesions can appear on the face, in the mouth, and on the hands, feet, chest, genitals, or anus. Some people get the rash first, followed by other flu-like symptoms, while some experience only a rash. The rash goes through different stages, including pimple-like bumps and blisters that crust and fall off before healing completely. The illness caused by Mpox typically lasts 2 to 4 weeks. Monkeypox diagnosis. To diagnose monkeypox, your healthcare provider will take a swab from a skin lesion and send it to a lab for polymerase chain reaction (PCR) testing, which can detect the virus. Monkeypox treatment and symptoms management. Monkeypox symptoms typically last from 2 to 4 weeks, and most people with monkeypox get better on their own without treatment. However, there are things you can do to feel better, including drinking plenty of fluids, resting, taking a warm oatmeal bath. Soaking in an oatmeal bath can provide relief for dry, itchy rashes. Using over-the-counter pain relievers and fever reducers. Currently, there are no treatments specifically for monkeypox infection. However, given the similarity between monkeypox and smallpox viruses, therapies such as antiviral drugs and immune globulin, developed to protect against smallpox, may be used to treat monkeypox virus infections, especially for people with severe symptoms. If you are infected with monkeypox, talk to your healthcare provider for more information on your eligibility for certain treatments, including the antiviral drug tecovirimat. When to seek medical care for M.pox symptoms. Call your healthcare provider if you have fever, aches or swollen lymph nodes, a new rash or sores, close contact with a person infected with M.pox. Seek emergency medical care if you have a stiff neck, chest pain, confusion, difficulty speaking, loss of consciousness, loss of mobility, seizures, trouble breathing. Prevention of M.pox infection. Anyone can get M.pox, but it can be prevented by limiting close contact with people with confirmed or suspected M.pox and by vaccination. Take the following precautions to help prevent M.pox infection. Avoid close contact with people who have been diagnosed with M.pox or who have signs and symptoms of M.pox, including fever and rash. This includes not sharing bedding, towels, and utensils used by the infected individual, which may be contaminated with the virus from skin lesions. Clean and disinfect high-touch surfaces. If it is necessary to be in close contact with someone with M.pox, wear a mask that covers your mouth and nose and wash your hands frequently with soap and warm water. M.pox can spread between the time symptoms first appear until the time the rash has fully healed. If you suspect you have M.pox or have been diagnosed with M.pox, there are steps you should take to help prevent spreading the disease to others. Follow all guidance from your local health department. If you have an active rash or other symptoms, stay in a separate room or area away from people or pets you live with, whenever possible. Isolate at home until all of your skin lesions have scabbed over and other symptoms have resolved. Wear a mask that covers your nose and mouth if you must be around others. Vaccination to prevent M.pox. Vaccination can help prevent M.pox infection for those who have been in close contact with someone with confirmed or suspected M.pox, or who are at high risk for exposure. 2 vaccines licensed by the FDA to prevent smallpox are also used to prevent M.pox infection: JYN-NEOS, also known as Imvamune or Imvanex, and ACAM2000. Currently, there is a limited supply of JYN-NEOS, which is prioritized for people exposed to M.pox or at high risk of exposure. ACAM2000 is available but requires special handling and is not suitable for everyone, including those with certain skin conditions, pregnant individuals, or those with weakened immune systems. Vaccines are being distributed through local health departments and select clinics and health systems for eligible patients. The situation now. As the situation with M.pox continues to evolve, it's crucial for the international community to remain vigilant. The emergence of the more transmissible clade I strain highlights the need for heightened awareness, prompt action, and strong preventive measures. Understanding the severity of this outbreak helps us all take the necessary precautions and stay informed. By following health guidelines, supporting vaccination efforts, and staying up to date with the latest information, we can better protect ourselves and our communities from this ongoing global health threat. Thank you for watching. If you found this video informative, please give it a thumbs up and share it with others who might benefit from this information. Don't forget to subscribe to our channel to help us reach our next milestone of 500 subscribers. Stay vigilant, stay informed, and most importantly, stay healthy. See you next time.